Double masking is in the spotlight again as President Biden, Dr. Fauci, and other officials started doubling up protection against COVID-19.
So if you have a physical covering with one layer, you put another layer on, it just makes common sense that it likely would be more effective.
Dr. Paul Pottinger of UW Medicine and professor of infectious diseases says there's probably value in some cases in wearing a second mask.
I would really rather someone wear one mask that works very well for them.
Dr. Pottinger says if people want to follow President Biden and Dr. Fauci's example, they're welcome to.
Look, the truth is that the more layers of fabric you have between yourself and the outside world and all the germs out there, then the lower the chance of something sneaking its way through.
What can you do now to make sure your mask is effective? Well, if your glasses are fogging up, you need a tighter seal. If you can hold your mask up to the light and see through it, that's a no-go. You'll want a mask with a dense weave, making it difficult for any particles to get through.
If you choose to wear a second mask, I'm not against that. What I really need is for everyone to wear some sort of mask. If we all do that, and even with these new variants coming in, we can really help to flatten that curve.
The CDC has not revised its current mask guidance. It still encourages Americans to choose well-fitting masks with 2 or more layers of fabric and to avoid surgical masks meant for healthcare workers.
All work together to get through these strange and trying times. One issue has become a sticking point: wearing a mask. For some, wearing a mask isn't a big deal. Some say it's actually a small deal, a temporary inconvenience, similar to sitting on your sofa and the cushion is comfortable but not perfect. For others, wearing a mask is a much more serious issue. The following are actual medical reasons you may not be able to wear a face mask: a severe skin condition such as a severe burn, a severe lung disease, or you're under 2 years old, in which case please give mommy her phone back. But what if none of those actual conditions apply to you? What if you maybe can't wear a mask because you suffer from one of the following conditions? Scientitis, acute wussness, selfish syndrome, chronic dickishness, pathological ignorance, or severe moronness. Don't worry, now there's a solution. If you suffer from one of those conditions and don't want to wear a mask, just stay home. Seriously, don't go out. Stay the hell away from me. Let the rest of us just get on with it.
Gay and bisexual men. Over the past decade, young men who have sex with men, or MSM, and especially young MSM of color, experienced increases in HIV diagnoses. MSM also made up the majority of reported syphilis cases in 2014, and half of these men were also infected with HIV.
Stay the hell away from me.
There has also been an increase of gonorrhea in gay and bisexual men, in an environment where we are down to our last effective treatment option: a single dose of 250 milligrams IM of ceftriaxone and a single dose of 1 gram of azithromycin oral.
Stay the hell away from me.
Was the concern about sexual activity. We saw that this concern was reported a lot less in 2016 compared to 2010 for both genders, and the concern about the child being male actually decreased all the way to 3%, so it was very low reported reason for lack of vaccination.
Stay the hell away from me.
Test. CDC recommends screening sexually active gay and bisexual men at least once a year for HIV, syphilis, chlamydia, and gonorrhea. Those with multiple or anonymous partners should be tested more often. Follow-up testing for syphilis due to repeat infections is important to do, as well as rectal and throat screenings depending on the type of reported sexual history.
Stay the hell away from me.
I think our data really informs them that the concern about sexuality and the need to address sexuality prior to recommending or discussing the vaccine really is a much lower priority for parents and should not serve as a barrier to recommendation.
Stay the hell away from me. Let the rest of us just get on with it.
Anal sex is totally prohibited. Homosexuality is totally prohibited